Risperidone, also called Risperidone. This is an antipsychotic medicine. Real important to understand the pros and cons of medicine like this. So first of all, it does three things. All antipsychotics, they treat psychosis. They also are mood stabilizers, and they can treat depression when added to an antidepressant. So those are all great things. You have to know the risks. The two biggest things, one is the risk of something called tardive dyskinesia, which is not life-threatening, but it's an involuntary movement of your lips and the mouth area. Then also something called metabolic syndrome. What this is basically is that you can get increase in your triglycerides and glucose and gain weight potentially, which could make it increased risk of diabetes. So having said that, you have to make sure that really any medicine you start, the benefit would have to outweigh that risk. So this medicine has been highly studied in schizophrenia and difficult to treat bipolar disorder. So if you have any of those things, particularly if you've been hospitalized, then this has to be an option, because despite those risks, you could monitor those risks and potentially keep somebody out of the hospital and keep somebody safe and keep people around them safe. This medicine has been studied in aggressive and violent people, for example. So if somebody has a history of that and it's due to their mental illness and you potentially need something to stop it, this has been studied. There's a lot of data even in children, all the way to higher ages as well. So I would say, there's certainly some controversy with these meds, but the benefit has to outweigh the risk.